All right, y'all. Good evening. Good evening. Yours truly, Dr. Pierre, favorite board certified internist. Welcome to another episode of Real Physician Reacts. This is where we come here every week live to answer some questions, to talk about some controversy that may have hit our social media streets. And I thought this week was a good week to ask the question. Now, mind you, I get this question asked to me all the time in reference to me. As far as being on social media, full disclosure, I've been on social media, especially doing the doctor thing on social media since 2000. Oh my God, I'm about to say 20, since 2008. So I've been on, since 2008, I've been representing myself in the medical field. But more and more, we're getting into situations where people are asking, and unfortunately, the question that they're asking is, hey, are you on social media too much? Are you doing too much here? So the article behind me discusses first of all, look how they title the article. TikTok streaming surgeon accused of botching procedures for years before license revoked. Now, there's so much to talk about just in this title, but let me just tell you from a general laissez-faire attitude, right? The fact that this person's license had to be revoked, not suspended, not indefinitely suspended. Like, no, they said, you cannot practice medicine in this state no more. And obviously it's in the state, right? They didn't say this is a nationwide ban, but they just said in this state, it's revoked. And let me be honest, if you get it revoked in one state, it's going to be kind of hard to get it, get a new license in other states without really showing that, you done turned some corner. So this person here, known as Dr. Roxy, she used to go as, what was her TikTok name? I thought I had it here. Looks like she had about 800,000 followers. Yes. Oh my God. Yeah. I don't see her @ name. I think they already deleted her @ name. So her @ name is not even in this here, but that's okay. Right. So she was a plastic surgeon who used to film her surgeries, film her procedures. Now, if you are and this may gross some people out, if you're a fan of like the pimple popper, right? That dermatologist out there in, West, I think she is in, right? So it's not out of the ordinary to see doctors, film their procedures. Unfortunately, in this case here, Dr. Roxy, not only was she filming the procedures, but she was doing a bad job at them. Like, let me tell you, if the pimple popper was doing a bad job, popping pimples over there, like they would take care of that pretty quickly. But the fact that she was doing a great job over there, I'm talking about the pimple popper now, you didn't see this like uproar of like, oh, she should stop filming, right? To the point where people go to the pimple popper just to be filmed. Like, just to be filmed, they're going to the pimple popper, right? Which, again, this was a wild thing. But you have a person like this, right? A surgeon who was filming, who was messing up cases while said filming. And when you get to the point where your license is revoked, the Board of Medicine, and for those who may not know, the Board of Medicine is made up of other doctors. So this isn't like some random, group they picked off the street. No, this is a board of other physicians, may not necessarily be in your specialty, but there are other physicians who are looking at you and saying like, no, you do not need to practice medicine anymore. Like, that is how severe that got. Now, mind you, we just had, and just so people can kind of get a little bit of context, the lady who was saying that the COVID vaccine was going to magnetize you like Magneto, they suspended her license. And she was doing some wild, like she was refusing to answer questions, refusing to answer subpoenas. And all they did was suspend her license. They got to the point with this lady that they had to like revoke. They said, nah, give me that license back. So the question comes, like, is it like, especially, and I say this, right? I know I'm in like this glass house. Like, are we getting to a point where social media is becoming a bad thing for physicians? Now, I got my thoughts on it, right? And you know me, I'm going to give my thoughts. But it clearly seems like there are some people who cannot handle the things that come with social media. I got a good friend of mine who I work with, who she follows me on social media, and she sees y'all comments, right? She sees y'all angry. I'm not saying y'all. If y'all are on the live, I'm assuming y'all like seeing me, right? But those who don't like seeing me, like, she sees their comments. She sees how mean-spirited they are, how hateful they can be sometimes. And she's asking me, hey, why are you still on social media if that is the type of reception you get? Now, of course, those types of negative feelings is like the small majority. You don't get 30,000 people following you and that's just on TikTok, right? I got like 1,500 on YouTube, I like 12,000. Like, so you don't get people following you because they hate you, right? So I understand that those who hate me are a small number. But even to her, she can't even fathom that small number would have so much vitriol to a physician, because, we're typically in a position where we're the ones kind of helping. Now, I can tell you, the pandemic didn't help things, right? Especially the side that I'm on. The side that I'm on, the one that's telling you, hey, we should social distance, we should lock down, we should mask when it was appropriate and all those things, and get vaccinated. That's not necessarily the friendlier side. So you tend to find these people who really, really hate you, right? That's okay. Again, like I said, we don't lose sleep over that. Some of my friends lose sleep over it. Some of my friends can't even imagine the comments I get and wonder how I keep doing this thing, right? They can't even imagine it. But but that's because I can handle it. Like I said, I've been doing this since like 2008. I got 15 years of being online as Dr. Pierre. Now, mind you, like, don't tell my medical school, right? But when I was a medical student, like, I was like Dr. Pierre, right? But I used to tell people, like, hey, I'm a medical student. Like, this is just my blog. The future. I used to say the future Dr. Pierre's, right? So don't tell Nova Southeastern University. And I wasn't giving medical advice anyway, so it didn't matter. But neither here or there. But like, there's some people who clearly cannot deal with everything that comes with it. So again, we have this lady here, Dr. Roxy. I'm reading this article here. She's faced lawsuit after lawsuit after lawsuit, a lot of them complaining about the fact that she's putting them, online, on social media. So I used to say student doctor. Yeah, that used to be student Dr. Pierre. Student Dr. Pierre, that's what it was. So she was like, this lady, Dr. Roxy, was online, right? TikToking away. Damn, I never seen her account. I'm not sure when she actually got deleted. I never seen her account. Thankfully, I guess. But she was online. She was, promoting herself, and she would get complaints from the medical board saying, hey, you know what? You're doing a little bit too much, and she would kind of ignore it. And again, like I said, when you're a great surgeon, when you don't have complications, that's good. The problem is when you're not, a great surgeon. I'm not saying she's not a great surgeon, but, complications are happening, right? And obviously, you can't 100% prevent you from having complications. But if you start having a lot of complications to the point where a group of your peers are like, nah, I don't want you practicing medicine anymore. Right. That's all I got to say. We'll let everyone else kind of fill in the blanks. So you have people who get the type of fame that I guess they're looking for. You have people who, some of my comments were filtered. Oh, okay. I forgot I have a COVID filter. When I'm usually doing my my non-COVID lives, I put a couple words in there that I don't see on my like vax, Biden, stuff like that. And TikTok's telling me like it's somehow someone's trying to type it, but whatever. So when you have a case where your peers are like, I don't want you practicing medicine. Yeah, no, I have to do it because they would fill my whole timeline. Y'all wouldn't be able to see nothing. You have to ask yourself, man, what am I doing? Like, what am I doing where the drug of social media is so great that I'm willing to risk my career? Like this medicine, I'm willing to risk my career for this drug of social media. And the reason why I think these is so poignant, right? Like again, we have not only do we have her, right, and we have the lady who thought we were going to be Magneto after the vaccine, right? And they suspended her license, right? These are people who, once they got the fame, the drug that social media was, they totally threw away like how much, right? Like, oh, and we'll talk about Dr. Miami too. They totally threw away how much work they put in to get to medical school, to pass medical school, to pass the boards, to pass the like, just totally threw it away because of this drug of social media. And it's so obvious and evident that, like, yes, you can use this for good. You can definitely use this for good, but there's such negative consequences if you don't, that I don't think a lot of people recognize, right? And I talk to medical students all the time, and even residents, right? I talk to them, especially because they're like this. I love to say the younger generation, right? Like, mind you, I'm still young in the career from a physician standpoint, because in fact, at a residency, I'm just going to hit the 10-year mark like next year. Like next year will be 10 years out of residency, which is young. But like, I'm old enough that I can look at my medical students and my residents and be like, hey man, like I didn't used to do that when I was a resident. So I love that. I'm kind of stuck in the middle in that way. But the medical students of today, the residents of today, are way more savvy when it comes to social media. They live on it. Like they breathe it, right? So imagine me telling them like, hey, yeah, you can't, like, if you're going to go this route, you can't go on social media, right? Like imagine me, like that's not happening. I got kids now, they're 7 and 10. They turn 8. My twins turn 8 tomorrow. And I can give them my iPhone, I can give them my iPad. They know how to work it. So I understand that the younger generation is just brought up in this technological world. So trying to get them to like say, no, you can't go on social media, that's just not going to happen. So we, the older generation, especially those who are on social media, because not a lot of us are on social media, despite what it may look like, we have to be the ones to be able to kind of educate them and say, hey, you know what? I'd kind of relax on that. That's kind of wild over there. I would relax if I were you. So it's extremely, extremely important from that standpoint there. So as someone said, Audrey, right? Let's highlight Audrey. Audrey said some doctors like Dr. Miami made most of his customers off social media, 100%. And that's one of the things where, and people say this all the time to me, because like I do inpatient medicine, like in the hospital, in the rehabs, like, so I don't have an outpatient practice. So, and people all the time ask me, oh, hey, especially those who are local in South Florida want to come to my practice. Like, oh, I don't have a practice, right? So, but they see me so visibly online, and obviously they like what they see. They're like, man, I would love for this person to be my doctor. And like, I don't even have the opportunity to even be their doctor, right? I just say like, I just like doing what I do. So when you have doctors like Pimple Popper, and I'm so sorry I cannot. In fact, because I don't even want to like try this lady and not remember her. Try this woman and not remember her name. Who is the Pimple Popper? Because honestly, it's like, for me, she's so ubiquitous. Dr. Sandra Lee. I apologize, Dr. Sandra Lee and all her friends, right? Because like for me, she's Pimple Popper, right? But like Dr. Sandra Lee, Dr. Miami. These are people who recognize like, hey, you know what? I can use this social media for amplification of my message, of my brand, of myself, and I could take it to the next level. And clearly they did that. Clearly, like, I mean, those are some of the best examples of when you do social media right, especially as a healthcare provider, like it could be great for you. And unfortunately, the Dr. Roxy's of the world, this anti-vaccine, what is her name? Sherry Tenpenny, that's the Ohio anti-vax doctor, all right, license suspended, right? There's so many, like you can see different spectrums of when you do it well and when you don't do it well, right? And of course it can be scary, because if you're in the healthcare field, like you don't have to just be a doctor, right? I got friends who are lawyers, I got friends who are financial advisors, videographers, photographers, and they're scared to go on social media because they don't know which way the social media spectrum is going to have them either looking amazing or like, oh, that's like, no, get this person out of here. So yes, like it's obviously the title says, is it too much for doctors, right? But this is for anybody, especially in the professional field, understanding that there are definitely dangers either way. Definitely dangers either way to this thing, and you just have to do it well, right? Because if you don't do it well, you'll end up like this doctor here. She's a surgeon, plastic surgeon. I can't even for those who don't know, to do plastic surgery, it is 5 years of general surgery, and I think it's 2+ years of additional fellowship in plastics. So 7+ years of residency after your 4 years of medical school, after your 4+ years of just the time you throw away because you get bit with the social media bug. That is just so wild to me. So wild to me. Like let's make sure we don't there's no question. Oh, let's see here. Girl called Kyle says you can tell who the right doctors are though by the way they speak, but that pack side got me. Yeah, no, it's very evident. It's very evident the docs who just really like doing this, like we do this, like I said, I have no outpatient practice. You can't be my patient. There's zero that I gain from you liking me as a physician, right? Except, a follow and a subscribe, which I love. Subscribe to the YouTube, subscribe to the podcast. But because I generally like doing this, I can keep on doing this all day. There's no ebb and flow. There's never a slow news day for me. I can get out here and talk all day. But I do love educating because it is a fun thing, especially when, people just have general, questions that they just want answered. And maybe they don't have access to talk to an internist who may be able to answer that, crazy question about like, hey, what about that monkeypox thing? What about COVID? What about this vaccine? What about diabetes? What about they don't necessarily may not have access to people who can just really answer these questions, especially for free, right? So when you can, you definitely try to take advantage of it, for sure. Oh yeah, so that was it. Dr. Rubin said there are 7,000 doctors on TikTok giving advice, answer questions, providing. Yes. And first of all, Dr. Rubin is definitely another one to follow. I think he said it before. I don't want to butcher it, but he says he's like one of the few allergists on this, right? And first of all, in the physician world, it's so difficult to find an allergist, right? So imagine the allergy, I'm trying to think now in my mental Rolodex how many allergists I know, and it's like 2 people, Dr. Rubin, right, and this other allergist that I did an interview on a while ago, right? It's been that long, right? So allergists are not necessarily few and far between, but when you know an allergist, you're like, oh yeah, that's the allergist, because you don't really see that many. And it's so important, when you're on, and again, this is just TikTok. Imagine the amount of doctors who are on YouTube, the amount of doctors who are on Instagram, the amount of doctors who are on Facebook, amount of doctors who are even on Clubhouse, right? There's doctors everywhere who just love doing this thing called education. And we will go to all of these different platforms, not because we really, really love doing it, even though we do. We go because we know those who want and are seeking the answers are there. Those who want to be on Clubhouse, hey, they're going to be on Clubhouse anyway. Let me go on Clubhouse. Let me answer this question because I know, people are going to go crazy for it, right? Let me go answer this question on YouTube. Let me answer this question on TikTok. Let me answer this question on Facebook because I know the people are there. Extremely important. Yeah, shout out to Dr. Rubin. I learned so much in your opinion. Yes, oh, definitely. Thank you, Octavia. And first of all, and I tell people all the time, especially because I have an osteopathic degree from Nova Southeastern, and I got my master's in public health from Nova Southeastern, emphasis on program evaluation, right? And I always love to throw in the emphasis because that's what my thesis was on. Because it makes it so great, right? Because I'll go into a practice, I'll go into a rehab facility, a hospital, and of course I have my doctor hat on, but I'm just evaluating just the process of how everything is going right now. The way everything is going, I'm like, yeah, they could do this better. Should have paid the nurses a little bit more. So I can't turn my mind off. And I tell people all the time, I don't think I would be I don't think I'd be the great physician that I am today, to my own horn, without the fact that I got my public health degree, because the public health degree really just makes you think about everybody. Like, I can't just think about and it's part of the reason why I'm on social media, because I know that, I could talk to, the patient I see in the rehab about their diabetes, about their cholesterol, about, the COVID vaccine. I can tell them about that, but like, I need to tell everyone that they may also be in contact with as well. What's the best way to do it? Oh, let me go in, hop on social media and do this thing called social media. That's why I started. When I started, I called it Lunch and Learns. So, every Tuesday and Thursday during my lunch break, I talk about a topic, Tuesdays, Thursdays. And then from that, I started blogging. Then I went to the videos. Then someone said, hey, I would love the audio aspect of it. Boom, we went the audio aspect of it as well, podcasting. And I would do YouTube as well to kind of, bring it all together, right? So I love the social media thing. And I just love the fact that I can do it within my field of healthcare and still be able to educate. And I enjoy doing it, from that standpoint there. Let's see. So it says it's hard to determine who's in and who's out. Yeah, no, I think that's I think that's what's tough too. Now, this is something that this is what I usually would tell my healthcare colleagues, right? Who are not just healthcare, but obviously my business professional colleagues who want to do the social media thing, because a lot of them feel entrapped. That like, hey, like for example, like me, I'm a physician, I'm an internist, right? But like, I think last week or so, we went on a nice little rant talking about killer whales, right? Because I was just very interested in evil killer whales. I was very interested in it. And I have a lot of my colleagues who, they may be, surgeons, pathologists, OB-GYNs, whatever. They're only going to talk about that. Like, they're not deviating whatsoever. So, and someone mentioned that it gets to a point where it becomes a part of just, like, this is just all they do. When they're on social media, they're doing the medical thing, and they don't do nothing else. Like, if you follow me on Twitter, especially because, college football season is about to come around, I'm going to be talking about Florida State every Saturday, right? So you have to be very well-rounded, I feel, right, if you're going to be as successful as you want to be. And it's not saying that you can't come on here and only talk about the one thing, but then what happens is if you only talk about the one thing and then you try to talk about something different, people are going to be like, oh, well, what are you talking about? Like, where'd that come from? Right? So I always suggest trying to incorporate your personality and not just make like the personality you present on here the only thing that people know you as. Again, like, I'm reading because I read several articles on Dr. Roxy, right? And her name was Katherine Roxanne Grawe. So I'm reading just several articles on her, and you could just kind of fortunately see the timeline of destruction. Right? She had a couple mistakes, had a couple of complications. It's not the end of the world. But then she was kind of counseled on and said, hey, you know what? If you can kind of slow down on the social media stuff, slow down on the posting, your patients are getting concerned, your patients are making complaints. She ignored more complications, more issues, more lawsuits. And then you just kind of see it building. All the while, she's still posting on social media like it's nobody's business, still doing, the thing that got her trouble in the first place. Now, because I don't want to tell doctors that they should never go on social media. That's crazy. No, we're not going to do that. Like, I'm not going to say that you should never go on social media, but I do think it's important to have some type of restraint on how much social media you do, especially when it comes with the patients, right? Like, unless you're Dr. Sandra Lee, Pimple Popper, Dr. Miami, right? And it's fully invested in, hey, my practice, this is what I do. And the people who come to you say, hey, I know that's why what you do, and that's why I'm coming to see you. That's when it become a problem, for sure. Yeah, I see that. Our professor says when they prioritize popularity over safety, that's a problem. Yeah, that's really where we start getting in trouble. Like I said, it's let me tell you, y'all. Like, again, the Magneto anti-vaccine lady, her license only got suspended, and that's after she kept refusing to answer questions, refusing to answer subpoenas. Like, even though she was still telling people that the vaccine was going to cause you to attract metal, right? Like, no, we only suspended you. Why? Because when it's a group of your peers, those who who went through and say, yeah, man, I understand exactly what you've been through. I know the long nights of medical school and residency. I don't want to take your license away, so I'm just going to suspend you. But when you get to the point where they're saying license revoked, like, nah, give me that license. Now you done said, hey, you know what? You don't even care about the patients no more. Like that is when, the problems galore, right? But it's unfortunate because that's where social media, again, that high of social media could be very damning for sure. Let's see here. Oh, and I love this too, right? Octavia says there are good doc and back doctors out practicing in our communities. 100%. 100%. Right. And again, they don't even have to be on social media, right? So again, we don't want to make it seem like only the bad doctors come on social media. We know that, they out there off the grid as well. But it's just one thing where if you're a bad doctor and then you add on gasoline to the fire of being on social media and being super active and being like, that's when roses fly. That's when roses fly for sure. I love this question, right? Personality is often lacking in physicians. And I think, first of all, that's a great statement, great point. And let me tell you, the people who were in medical school, were in residency, and were kind of had a flat affect and just kind of blah and just kind of just, they were smart, obviously, because they had the grades to get there. But, they just like, though you're not shocked, right? You're not shocked at all. And I think that's why it's difficult for a lot of physicians who may want to get online because they know their personality ain't the best. So they have to either hyperbolize a type of personality, whether you're like super jovial, right? You're dancing everywhere, where you're they just have to like make it the max to try to cover up for deficiencies. But I tell people all the time, especially if you're on social media, enough and you post enough, like, we're going to know if you're lame, right? We'll know if you're lame. I think I was just checking the other day. I think here on TikTok, I almost had like 1,000 videos, which is wild. I think I almost have 1,000 videos uploaded. I'm pretty sure by 1,000, you'll know whether like, hey, this guy, I got to get him to unfollow. He's not a person I want to be seeing from that standpoint there. Let's see. Let's see. Oh, Jay says, a few years ago, I used to binge your podcast while at gym. I appreciate that, Jade. Appreciate that, Jade. Jade with a shout out says she used to binge my podcast while at the gym. Yeah, and like I said, and my podcast, like I said, I stay in my little world, right? I know people like to talk. I know what people want to hear. And I do a much better job at just bringing guests on, because I get as excited by the guests that I think my audience may get excited. I'm like, oh wow, this like, oh, I gotta bring you on. I gotta have you talk, because there are so many like professionals out here, especially in the healthcare world, who you can't. It's first of all, it's like pulling teeth to get them to come on a show like this. Or social media in general. But I know they're so smart that I'm like, if you just need to let the world know what you're doing. And so I appreciate that, Jade, for listening to the podcast. That's their point. Let's see. Make sure I don't got any more questions. Okay, perfect. Yeah, no, I think it's tough, right? Yeah, like I said, we're gonna make this a good episode today. We're not gonna make it too long. I just had to get on here and kind of talk about it, right? Because obviously, like I said, we were just coming fresh off the Magneto anti-vax doctor getting her license suspended. And then I just happened to come across this. This happened like last month. This happened like early last month, right? So, and you're seeing, unfortunately, if you, I would suggest it, right? But if you just do a search for doctor's license revoked, there's a lot more, reasons for your license to get revoked or suspended or everything else. But you're seeing a lot of the claims talk about how social media is the play. So I want to make sure, my medical students, my pre-med students, my residents out here who are on social media, right? I just want to make sure y'all do it right. I'm not telling y'all get away from social media. I'm not telling y'all to not document your experiences. I just want y'all, to do it careful, right? Because people are watching. And like I said, some people, can't wait to see you trip and fall. And that just is what it is. Like, I'm sorry. Right. So again, first of all, appreciate everyone for joining this week's live. Like I said, we are going to be, I don't even know what we're going to talk about next week. I have to, oh, I know. In fact, I think about it. I know exactly what we're talking about. My wife is the CEO of Autism in Black, and we're actually going to be doing a webinar in September. So I'm going to bring her on to kind of talk about that webinar. So, you can see my Autism in Black shirt. I'm repping her company there. So y'all be blessed. Y'all have a great evening. I'm going to see you guys next week on the live, but I'll be around, responding to comments or posting videos. Make sure you like, share, follow.